The silent pandemic: antimicrobial resistance. Antibiotics revolutionized medicine in the 20th century, transforming the way we treat bacterial infections. These wonder drugs saved countless lives, turning once deadly diseases into manageable conditions. However, their overuse and misuse have fueled a silent pandemic: antimicrobial resistance, or AMR. This growing problem is largely driven by the excessive and inappropriate use of antibiotics in both humans and animals. AMR occurs when microorganisms evolve to resist the effects of antibiotics, making infections harder to treat. This means that the drugs that once cured infections are becoming less effective. This poses a grave threat to global health, as resistant infections can spread rapidly across communities and borders. AMR is no longer a future threat, it's a present reality. We are already seeing the impact in hospitals and clinics around the world. The World Health Organization has identified AMR as one of the top 10 global health threats, urging immediate and coordinated action. Without effective antibiotics, many standard medical procedures, such as organ transplants and cancer chemotherapy, become extremely risky. These treatments rely on antibiotics to prevent and treat infections. The consequences of inaction are dire. If we do not address this issue, we risk losing the progress made in modern medicine. We face a return to a pre-antibiotic era, where even minor infections could lead to severe illness or death. Simple infections could once again become deadly, underscoring the urgent need for global action to combat antimicrobial resistance. One of the core principles of stewardship is using the right antibiotic for the right infection. This means that healthcare professionals must be vigilant and precise in their approach to prescribing antibiotics. This involves accurate diagnosis and understanding the local patterns of antibiotic resistance. By knowing which bacteria are prevalent in the community, doctors can make more informed decisions. Equally important is prescribing the appropriate dose and duration of antibiotics. This ensures that the medication is effective while minimizing potential side effects. Shorter courses of antibiotics are often as effective as longer courses and can help minimize the development of resistance. This approach not only benefits the individual patient but also the broader community. De-escalation is another crucial aspect of stewardship. It requires constant monitoring and reassessment of the patient's condition. It involves starting with a broad-spectrum antibiotic if necessary, and then switching to a more targeted antibiotic once the causative organism is identified. This strategy helps in reducing the risk of resistance and ensures the best possible outcome for the patient. Education and training are paramount in promoting antibiotic stewardship. Healthcare professionals need to be equipped with the latest knowledge about AMR, appropriate antibiotic use, and stewardship practices. Continuing medical education programs, workshops, and online resources play a vital role in disseminating this information. It's also crucial to educate patients about the importance of antibiotic stewardship. By empowering healthcare professionals and patients with knowledge, we can foster a culture of responsible antibiotic use and preserve these life-saving drugs for future generations.